Hi, this is Meenakshi Jolly, and today we'll talk about hair loss in patients with lupus. Lupus patients experience skin involvement quite frequently, and it includes losing hair. When a person is sick with any disease and that sickness continues for some time without getting under control, people tend to lose hair. And this is no different in patients with lupus. The reason being that when you're sick, the energy of your body that you gain from eating, as especially protein, are being utilized in a different way, in a different direction, in putting up a fight, whether it is against infections or in autoimmune diseases, fight against your own body's cells. So that protein is not being utilized towards positive things like growth of hair. It's not available, and that makes the hair brittle, fall easy, or thinning of hair. Hair issues can happen therefore in patients who have active lupus that is not well controlled or poorly controlled, or with flare of lupus. But it can also happen from a lot of other things. It can be a side effect of some of the medications used to treat lupus. It can be a side effect of any other medication that you may be using, which is not for lupus. It can also be from hormone problems that patients with lupus may have, like thyroid problems. If your thyroid is under functioning, you may be losing hair from that, or sometimes even imbalance in the hormone levels, sex hormones of the body may also cause hair loss. Poor nutrition. If your appetite is low because of any reason, whether you are depressed or in pain or have reflux issues or just tired or alone or just don't feel like eating, nutrition could suffer, and hence the health of the hair can also suffer. Some medications, especially that are used in lupus, can cause hair loss. Cytoxin or cyclophosphamide is one of the top ones in that, and do think about not only lupus but the medications used in lupus also as a cause of hair loss. Sometimes some skin rashes like discoid lupus in the scalp itself can cause areas of hair loss, and these need to be addressed, and sometimes you may need to see a dermatologist to do injections into your scalp or such to limit the amount of damage and scarring. Once scarring has happened in the scalp, then the possibility of that hair coming back in that area may be less. Once hair loss has set in and it is permanent, in case it is permanent, then there are several ways that one can cope with loss of hair. One can deal with it by adopting a good, healthy outlook towards it. And there are various strategies that are available, including from good quality wigs to hair extensions, if that is something you prefer, or head wraps that can be available. Recently, I have even seen some advertisements for a spray of hair fibers that can help cover up the area in case you were going out for an event and were conscious about thinning of your hair or balding of the hair. Do remember that women do lose hair normally also as we grow older, and the hair tends to become thinner at the top part of our scalp, and that may be a normal process. Do discuss this with your primary care doctor as well as your rheumatologist to discuss what may be some of the things that may be causing your hair loss.